Okay, let's talk about the delivery of a baby. This is the culmination of the pregnancy and a transformative experience for the mother and the newborn. We can break down the process into stages and discuss some key considerations. The stages of labor. Labor is typically divided into three main stages. 1. First stage of labor. Dilation and effacement. Early, latent phase. Contractions. Contractions begin, often mild and irregular, lasting 30-60 seconds with 5 30-minute gaps. Cervical changes. The cervix starts to thin, effacement, and open, dilate. This phase can last hours, even days, especially for first-time mothers. Mother's experience can feel like strong menstrual cramps, back pain, or pressure. Active phase. Contractions. Contractions become stronger, longer, 45-60 seconds, and more frequent, 3-5 minutes apart. Cervical changes. The cervix dilates more quickly, from about 4 centimeters to 7 centimeters. Mother's experience. Labor intensifies, and this phase often requires focused coping mechanisms. Transition phase. Contractions. Contractions are very strong, long, 60-90 seconds, and frequent, 2-3 minutes apart. Cervical changes. The cervix completes its dilation to 10 centimeters, which is considered fully dilated. Mother's experience. This is often the most challenging phase, marked by intense contractions, pressure, and sometimes feelings of being overwhelmed. 2. Second stage of labor. Pushing and birth. Pushing. Once the cervix is fully dilated, the mother begins pushing with each contraction. This can take a few minutes or a few hours, depending on various factors. Descent and crowning. The baby moves down through the birth canal. Crowning occurs when the baby's head becomes visible at the vaginal opening. Birth. With continued pushing, the baby is delivered. Mother's experience. A feeling of intense pressure, but also a feeling of progress and an increasing urge to push. 3. Third stage of labor. Delivery of the placenta, placental separation. After the baby is born, the uterus continues to contract. These contractions cause the placenta to detach from the uterine wall. Placental delivery. The placenta is then expelled from the uterus, typically within 5-30 minutes of the baby's birth. Mother's experience. Contractions might be felt again, but they are generally much milder than those during labor. Different types of delivery. Vaginal delivery. The most common type of delivery, where the baby is born through the vaginal opening. Cesarean section. C-section. A surgical procedure in which the baby is delivered through an incision in the mother's abdomen and uterus. This may be planned for certain medical reasons or performed in emergency situations. Pain management during labor. Natural methods, breathing techniques, relaxation exercises, movement, water therapy, massage, and support from a partner or doula. Medications. Pain relief options include epidural anesthesia, spinal anesthesia, and intravenous pain medications. Key considerations during delivery. Monitoring. Throughout labor, the mother's vital signs and fetal heart rate are continuously monitored. Positioning. Different positions can be used to facilitate labor and delivery. The mother should be encouraged to find comfortable and effective positions. Episiotomy. In some cases, a surgical incision, episiotomy, might be made in the perineum, area between the vagina and the anus, to create more space for delivery. However, this is not routinely performed and is only considered when medically necessary. Assisted delivery. In certain situations, tools like forceps or a vacuum extractor may be used to assist with the delivery. Immediate postpartum care. Skin-to-skin contact. Immediate skin-to-skin contact between mother and baby is beneficial for both bonding and regulating the baby's temperature. Cord clamping and cutting. The umbilical cord is clamped and cut. Assessment of mother and baby. Both mother and baby are assessed for their health and well-being. Breastfeeding. Breastfeeding is often initiated soon after birth. Factors influencing delivery. Fetal position. The position of the baby in the uterus can affect the course of labor and delivery. Mother's health. Pre-existing health conditions and the mother's overall health during pregnancy can impact delivery. Labor progress. The speed of labor progression can vary significantly. Pelvic size. The size of the mother's pelvis can influence the ease of vaginal delivery. Medical interventions. The use of interventions like medications, induction, or cesarean section can affect the overall experience. Emotional and psychological aspects. Emotional support. Having a supportive partner, doula, or medical team is crucial for a positive birth experience. Anxiety and fear. Labor can be a source of anxiety and fear. Addressing these feelings is an important part of prenatal care. Bonding. The experience of delivery can strengthen the bond between mother and baby. In summary, the delivery of a baby is a powerful and complex event. Understanding the stages of labor, various delivery methods, pain management options, and potential complications can empower expectant parents to make informed decisions. It's essential to approach the birthing process with a combination of knowledge, preparation, and trust in the body's natural ability to bring a new life into the world. Do you have any specific questions about any particular stage or aspect of labor and delivery? Please ask in comment box.